Dr. John Torres with NBC News. Here on this Facebook Live, I'm going to go ahead and cover some headlines you've probably heard over the weekend and go ahead and answer questions that you might have. So if you have questions, please certainly send them my way. We try to get to as many of those as possible. And frankly, they're the best part of this because they're questions you have and they're always fantastic. But first, let me start with the headlines. We're going to talk about three different things. One of them, convalescent plasma. I don't know if you heard last night, but President Trump was on air along with Dr. Steve Hahn, he's the head of the FDA, talking about the emergency use authorization of convalescent plasma. Now, taking a step back, convalescent plasma is what is used to treat some patients with coronavirus, and there have been stories of patients being treated successfully. As of now, there have been 70,000 patients that have been treated with convalescent plasma. In a study that was recently done, patients were divided into a couple of groups. Some people got convalescent plasma that had high levels of antibodies. Other people got convalescent plasma that had lower levels of antibodies. And the ones that had higher levels of antibodies ended up doing better. Because of that, the government decided to go ahead, the FDA decided to go ahead and give them an emergency use authorization. But this is causing some concern among a lot of experts around the country. And first off, let me explain. Convalescent plasma is essentially plasma from people who have had coronavirus. They've had COVID-19 and they've recovered. When they recover, they tend to have high levels or at least some levels of antibodies. And so the plasma, the blood product that carries those antibodies, is used. They donate blood. They get the plasma out of the blood. They end up giving that to other patients who are having trouble fighting off coronavirus, and it helps them bridge that gap. Basically gives them a boost of antibodies to fight coronavirus. And in this instance, in these studies where they tried people with, and giving them high levels of antibody-laden convalescent plasma and others with lower levels of antibody-laden convalescent plasma, the ones that had the higher levels of antibodies did better. And so they said, well, let's go ahead and use this emergency use authorization, which is not an approval. It's different. Emergency use authorizations are used in times of public health emergencies because they think there's a treatment that looks safe and effective, and they want to go ahead and get it out there to people before they actually prove that it's effective or how it's going to work. The concern among experts are a couple of things. One, to date, we don't know at what dose people need to get this, how much antibodies need to be in that convalescent plasma, who should be getting it, what stage of their disease, how often they should be getting it during their disease. A lot of issues we don't know that come about when we have clinical trials. There are clinical trials that are undergoing right now for convalescent plasma. They're having a hard time recruiting people. And the concern is that now that it's got this emergency use authorization and people can get it without going to these clinical trials, the concern is that they won't be doing these clinical trials, so we won't get the information we need, or at least we won't get them for a very, very long time. And that's what has a lot of people concerned, a lot of experts concerned. And again, the main thing is, in this study, it looks like it helped people when they had higher levels of antibodies in their convalescent plasma versus lower levels, but they didn't study it against what we consider the gold standard, which is studying it against a placebo to find out if that convalescent plasma in the first place, high levels or low levels, is what was doing the trick, or there's something else involved in there. And as I tell people frequently, if you look at studies for drugs, studies for vaccines, they can get through phase 1 and phase 2, but when they get to phase 3, the road is paved with failures in phase 3. We have not gotten there yet with convalescent plasma. It's going to be harder to get there. So having this emergency use authorization, sure, it might be able to help some people, but overall, it's going to hinder some of the efforts we have to try and find out exactly what we need, how we need to give it, and when we need to give it. And that's the big concern out there right now. The second headline you might have heard is about a reinfection that happened in Hong Kong. And right now, to date, there's one patient that looks like they're reinfected with coronavirus. It's a strain of coronavirus that has changed a little bit from the prior strain they had an infection with. And here's kind of the story. We don't have all the details at this point, but here's kind of the story as we know. It was a young adult that had coronavirus, we believe mild to moderate symptoms of coronavirus, recovered from that coronavirus, has been doing fine for months. In a screening test that was done when he got off an airplane in Hong Kong, they were screening all the passengers. They found out that he had coronavirus. He was positive again, completely without symptoms, completely asymptomatic. So they would not have even caught him if it wasn't for doing tests on everybody that was on that airplane. And so what does this tell us? Well, first and foremost, to date, right now, there are over 23 million cases so far since the pandemic started of coronavirus around the world. Of those 23 million cases, one of them looks like it probably could be a reinfection. And so you have to put that in perspective. Extremely, extremely rare to happen. If it is a reinfection, if this virus has changed a little bit to the point where it was a reinfection, what we're finding out here too is with this person, at least this one case, that the person seems to have gotten some protection from their prior infection. And so they were infected before, now they're asymptomatic, whereas before they were mildly to moderately symptomatic. And so it looks like there's some protection in there from them having it before, even though they weren't fully protected from getting it. And so that's good news as well. What does this mean for the rest of us? At this point, absolutely nothing. It needs to be looked into further, need to find out if other people are starting to have similar type situations. But for the scientific community, it's going to raise a bit of awareness that we need to really double down on the vaccine and find out what's happening and at what stage we need to give people boosters, if any stages. And so this, again, goes back to that phase 3 clinical trial. In those phase 3 trials, they're going to need to be long enough so we can go ahead and look at people and say, okay, at the 6-month period, they've gotten reinfections, we need to go ahead and dose them again. Or they haven't, we think this will last longer, we can keep an eye on people as time goes on, because the concern is if the virus does change, then you might need to get yearly vaccines, much like the flu. If it doesn't change much, then you might not need to get those yearly vaccines, and one vaccine or perhaps booster vaccines might actually help out. We don't know at this point, and again, 23 million cases around the world so far. One case that looks like it could be a verified reinfection, and I'm saying looks like because they're still looking at it very heavily to find out exactly what's happening here. We won't know the details for a little bit, but it's been out in the news, so I wanted you to get some more information behind that. The third thing is a wedding that took place in May. It took place August 7th. The wedding itself, they think there are around 65 people at the wedding. To date, 53 of those 65 people have come down with coronavirus. Lots of concerns here. Number one, in Maine at the time, the limit for gatherings were 50 people, especially indoor gatherings, and this was an indoor wedding. We're not sure whether they wore masks, how many people wore masks, how well they did with masking and social distancing, but what we do know is, again, of the 65 people, 53 have gotten coronavirus. And unfortunately, one person associated with this has died. That person was not at the wedding, but they came in contact with somebody who was at the wedding, subsequently got coronavirus from them, and ended up dying because of it. The age group, 4 years old to 98 years old, of the people who ended up getting coronavirus. What does this tell us? Well, this tells us some things that we already know. Indoors, especially without social distancing, without masks, in large groups can cause issues. And this virus is very tricky, and it can travel very quickly between people. As I tell people all the time, one of the biggest things you need to look at is how many people will I be around, how close will I be to those people, and how long will I be around those people. In instances like this with the wedding, lots of people, 65, they were all indoors, and they were probably there for an extended period of time, which is why it passed to everybody else. This is what we call a super spreader event. And so this just reinforces the fact that we need to make sure that we have small gatherings and we do the things we know that work. And as I call them, the 3 W's. Make sure you wear a mask, make sure you watch your distance, and make sure you wash your hands. The 4th W that I've added to that is windows. Open windows, get ventilation, or better yet, go outdoors. Those things can help so we don't have a repeat of what went on here. But we're getting these instances that are showing us just how this virus can spread very quickly, even in a situation where you think you're safe. You have to be very, very careful. And hopefully when we see some of these gatherings that are going on in different parts, not just the U.S., or other parts of the world, and to see the subsequent spreadings, it's getting the message out to the rest of us that we need to double down on our efforts, especially as cases start winding down in the U.S. and before the second wave comes, or the third wave, depending on how you want to talk about it. But again, looking at the headlines here, one of them, convalescent plasma. The FDA just authorized emergency use authorization for convalescent plasma, which is giving some experts pause because they're worried, one, about clinical trials, also two, we don't know the full safety or efficacy, the effectiveness of the plasma, and how we should use it best to keep people healthy or at least get them recovering from COVID-19. Reinfection, one person possibly has reinfection of coronavirus because it changed to the point where it could reinfect them after their first one they had a couple months ago. And then 3, the wedding in Maine. Unfortunately, a lot of people got sick from that. One person associated with has died from it. So now let me see if you have any questions.
Do UV light products work for disinfecting?
So do UV light products work for disinfecting? The answer is yes and no. No, because for the most part, UV lights don't work, especially the way people use them. There are 3 main components to UV: UVA, UVB, and UVC. UVA and B are what we typically get from sunlight. That can work over time, but it's an extended period of time, as in hours, to get to kill viruses and other germs that are there. The one that works the best is UVC, but UVC is filtered out by our ozone layer, so we typically don't get it, which is a good thing because UVC is one of the ones that can cause skin cancer. So you have to be very careful with UVC lights to begin with. Should not be around people. It has to be extended periods of time of the light. The light has to be close to the source. So you can see it's very complicated how to use these. Some hospital systems, some industrial systems will use them. People leave, they put a robot in there that has UVC, moves around the room and sterilizes the room that way. But for most of us, for products we use, UVC will probably not be appropriate. You need regular cleaning, regular disinfectants that you can use, and of course, what we always talk about, washing your hands before you touch your face, are your best deals at this point.
What about goggles?
So what about goggles? How effective are goggles? And part of the question comes out because Dr. Fauci was asked a question about goggles a few weeks ago, and he said, if you want the maximum amount of protection, then goggles could certainly add to that. But we do know that the main routes for getting coronavirus are respiratory, through your nose and through your mouth. You breathe in those coronavirus particles, and that subsequently causes you to get COVID-19 and to get the infection. Theoretically, not even theoretically, it can get into your eyes as well. That's less likely to happen. There's two ways it can get. If you're near somebody where those respiratory particles get into your eyes, that can happen, and certainly by touching your eyes, that can happen as well. With goggles, it does a couple things. One, it prevents those viruses from getting to your eyes through the air, which again doesn't happen very often, and it prevents you from touching your eyes, so that could help. It could go a long way there. In healthcare systems, in the hospitals, we tend to wear masks, we wear shields or goggles. Main reason is because we're so up close and personal to people that have high loads of coronavirus and are coughing and are sneezing, and so it's possible we can get that. We cannot social distance enough in those areas because we have to take care of patients, and so we wear those protective measures. Out and about, everyday environment, don't really need them. If you want that extra protection, glasses can certainly help. They're not as effective as goggles, but they can certainly help. So wearing glasses, sunglasses, anything like that can certainly go a long way. So if you're in an incident where you can be around a lot of people, especially if people are screaming or shouting, then you might want to think about goggles at that point.
How long does COVID-19 live on surfaces?
So the question is, how long does COVID-19 live on surfaces? And it depends on the surface. It goes anywhere from a few days. Metals, 3 to 5 days it can last on metals. For plastics, it can last a couple days. Cardboard, usually about 24 hours. Fabric, it depends on the fabric. And fabric doesn't hold coronavirus very well. It doesn't live very well in the fabric, mainly because of the loose nature of the knit of the fabric. But regardless of what you have there, any one of these, you need to do a couple things. One, make sure you disinfect. And remember, there's a difference between cleaners and disinfectants. Cleaners clean off the dirt and the grime. Disinfectants actually kill the germs. But if you look at the disinfectants, always read the label on the back, because on the back it'll tell you how long you need to leave that product on. And a lot of them say you wipe it on or spray it on and let it sit there for 10 minutes and then let it dry or wipe it off at that point. So it needs that time in order to work on the virus itself. So the main point here, again, remember, washing your hands after touching something is very, very important. It's not the most likely way you're going to get coronavirus, but it is one way you could get coronavirus, regardless of what surface we're talking about.
Why do some COVID-19 side effects last so long?
So the question is, why do some COVID-19 side effects last so long? And there's actually a term for this, and there's a group. They call themselves the long haulers. And the long haulers are essentially people who have had coronavirus, had COVID-19. They've mostly recovered, but then they start getting these long-term symptoms. And these long-term symptoms could be things like fatigue. Fatigue tends to be a big one. People complain of stomach issues, hair falling out, a lot of different symptoms. The answer is we simply don't know why it's lasting so long, but it's probably not a product of the actual virus. It's probably a product of the body's reaction to the virus, particularly the immune system. And that can go on for extended periods of time for some people. And we're finding out that probably more people than we think are being affected by this. And again, you can look up online the long hauler groups that are out there. There are support groups for people that are having extended periods of symptoms. One of the big concerns is people say they go to their doctors and their doctors either don't believe them or brush it aside and say it's probably something else. My suggestion would be talk to your doctor about it. Look at articles that are online, take it to your doctor and say, hey, I think this might be part of what's going on with me because this is an unusual symptom. And your doctor should listen to you at that point and say, okay, let's sit down and talk about this and see what we need to do. Some of these, there's really not much you can do about them, but keeping an eye on you and making sure that things progress to a better state over time, that you get better as time goes on, is going to be important. For other symptoms, there might be something you can do about it. But again, it's called the long haulers groups and the long hauler syndrome, meaning that yes, these things do continue to go on for some people for an extended period of time.
Is it safe for retail stores to have their dressing rooms open?
So the question is it safe for retail stores to have their dressing room open? The answer is it depends. It depends on what they do in between people in the dressing room. If it's a dressing room where you go in, you come out, somebody else goes in, they come out, somebody else, no. Because every time somebody goes in there, they have the chance of spreading coronavirus to the surfaces and the air that's in there. The next person in there could get contaminated and that could continue. However, if it's dressing rooms where somebody goes in there, they look at the different outfits they're looking at, they leave, and then a worker goes in there and cleans everything, disinfects the area. Next person goes in there, then yes, those are the type that are safer to use at that point. But again, it's going to depend. So when you go to a store, look at the dressing room, see what they're doing, ask about their policies. How do I know that dressing room is disinfected when I go in there? And it's the same with other environments you're in out and about. You want to be extra careful.
Why are people so concerned about the coronavirus? Isn't the recovery rate very high?
So the question is, why are people so concerned about the coronavirus? Isn't the recovery rate very high? The recovery rate is, yes, the majority of people do recover. As of now, we think 35 to 50% of people have no symptoms. They don't even know they have coronavirus. And there's a large percentage of people that get mild to moderate symptoms, and they subsequently recover over a 2, 3, or 6 weeks time period. But there are that percentage of people that end up with very serious conditions. And like we talked about, some of them are having these long haul syndromes that go on forever and ever, or for months at a time. We have other people that get critically ill, and we've had deaths from coronavirus as well. And so the concern is right now around the world, 23 plus million people have had coronavirus, high number of deaths, high number of complications from this. And so even though it doesn't affect everybody, it is affecting a lot of people of all age groups. When this first came out, we initially thought, okay, maybe children are protected, maybe young adults are protected, but now we're seeing complications and deaths in those age groups as well, and we don't have any real rhyme or reason as to why that's happening. We know there are some pre-existing conditions, but there have been people without those pre-existing conditions that have complications at all age levels, and there have been people in their 80s and above who have had pre-existing conditions who have completely recovered from this. So it's a virus that we're still trying to get a good handle on, and that is spreading very rapidly still. And that's why there's a big concern about it, because you simply don't know if you're going to get it, if you're going to get complications from it, and if you could possibly die from it.
I thought the virus was only spread from the mouth or the nose, not surfaces. What's that?
So the question is, I thought the virus was only spread through the mouth or the nose, as in respiratory, and not surfaces. And here's what's going on. The vast majority of spread, we think, comes from respiratory droplets. And so you're in an environment where somebody coughs or sneezes, or even they talk or they breathe, and those respiratory droplets can come out. They can travel up to 6 feet. And so if you're not social distancing, if you're not wearing a mask, then you have a higher risk of getting those viruses into your body and creating that issue with COVID-19 and getting the infection. However, by the same token, if I'm coughing or sneezing or even talking, those respiratory droplets drop down. They can drop on a surface. When they drop on that surface, if I'm touching that surface and then I touch my eyes, my nose, or my mouth, those mucous membranes, those cells in that area can get infected with the virus that's on my hands, and it can get into my body that way. That's not the majority of ways it gets into your body. It's mostly through respiratory droplets, but that is a way it can get into your body. And that's why part of the W's I talk about, wear a mask, watch your distance, wash your hands is important, particularly washing your hands before you touch your eyes, your nose, or your mouth, because that's one way it can get in your system. Again, it's not the most likely way, but it certainly is one way it can get into your system.
Should we take vitamin D3 to activate our cells so they're ready to fight infection if we get COVID-19?
So the question is, should we take vitamin D to activate our cells so we can protect ourselves against COVID-19? You need adequate levels of vitamin D, and most of us have adequate levels of vitamin D or near adequate levels, and so you should be protected at this point. The reason this question is coming about is because there was a study done in the UK where they found out that people that were severely deficit in vitamin D were having a harder time with the complications of coronavirus. And essentially the treatment there was to get their vitamin Ds up to normal levels or near normal levels. But again, these are people who were deficient in vitamin D, severely deficient in vitamin D, not people that were either normal in vitamin D levels or near normal in vitamin D levels. So for the vast majority of us, getting a little bit of sunshine, you want to be careful with the skin cancer issues behind sun, so protect yourself there as well. But getting a little bit of sunshine, eating a good healthy diet, especially with foods that are fortified in vitamin D, can go a ways towards getting you there. You don't necessarily need supplements. And that's kind of the bottom line there. So again, let me go over the headlines we had. Number one, convalescent plasma. The FDA has just authorized emergency use authorization for convalescent plasma, which means it can be used across the country in a easier fashion without having to register or get paperwork or get permission to use it. However, the concern is, what will this do to clinical trials? Do we really know what the safe and effective parts of the convalescent plasma are and how we should use it appropriately? And that's the big concern going forward. Number two, reinfection. There was a gentleman in Hong Kong that we believe was reinfected with the virus a second time. One person so far out of the 23 plus million people that have coronavirus, but certainly warrants keeping a close eye to make sure that, see if this is happening to other people and see what it actually means. And then the wedding in Maine, where 65 people attended, 53 got sick. One associated with a person. They weren't at the wedding, but they were in contact with somebody who was at the wedding, got coronavirus, unfortunately died from it. What we know now, it just reinforces the fact that we need to make sure that we're not in large groups, we're wearing masks, we're social distancing, because it shows you just how quickly this virus can spread. And so, again, the important reminder, and I'll go over the W's, and I've added a fourth one: wear a mask, watch your distance, 6 feet, wash your hands, especially before you touch your eyes, your nose, your mouth, and windows. Open windows, try to get that fresh air and get outdoors if you can, instead of being indoors, especially if you're around other people. But otherwise, I hope you, your family, your loved ones, and your community, hope you have a happy and a healthy week.